Question 1. Scenario question. Mr. Taylor is managing a veterinary clinic where he encounters a situation with a dog that has been recently adopted from an animal shelter. The dog appears to be fearful and exhibits aggressive behavior towards new people. Mr. Taylor is concerned about the safety of the clinic staff and clients. He needs to develop a strategy to help the dog adjust and prevent incidents. What is the best approach Mr. Taylor should to manage this situation effectively? A. Use physical restraints immediately, such as a muzzle to prevent any aggression. B. Focus on behavior modification techniques, such as desensitization and positive reinforcement, to help the dog become accustomed to new environments and people. C. Keep the dog isolated in a kennel without any interaction until it calms down. D. Ignore the behavioral signs and allow the dog to naturally adjust to the clinic environment with interference. Answer. B. Focus on behavior modification techniques, such as desensitization and positive reinforcement, to help the dog become accustomed to new environments and people. Explanation. This approach is grounded in understanding animal behavior and applying methods that reduce stress while promoting a positive association with new experiences. Positive reinforcement, such as offering treats when the dog shows calm behavior, helps to condition animal to respond less aggressively over time. Desensitization involves gradually exposing the dog to situations that trigger its fear, allowing it to adjust in a controlled and non-threatening manner. This method is preferred because it addresses the root cause of the behavior, fear, while ensuring the safety and welfare of the animal and humans involved. Option A is incorrect because physical restraint, like using muzzle, should only be last resort when the animal poses an immediate risk to others. Option C may result in further isolation, which could heighten anxiety and fear, worsening the situation. Option D is also incorrect, as ignoring the behavior and not addressing the root cause could lead to potential safety risks and worsened aggression. Question 2. Which of the following is the most accurate method for identifying nutritional deficiencies in an animal? A. Regularly monitoring the animal's weight and body condition score. B. Observing the animal's coat for changes in texture, shine, or shedding patterns. C. Administering nutritional supplement to see if the condition improves. D. Relying solely on the animal's behavior as an indicator of nutritional needs. Answer. B. Observing the animal's coat for changes in texture, shine, or shedding patterns. Explanation. Observing physical characteristics, such as changes in the coat, is one of the most common signs of nutritional deficiencies. For example, deficiencies in essential fatty acids, proteins, or vitamins can cause the animal's coat to become dull, dry, or prone to excessive shedding. These visual signs serve as an important indicator that further investigation in the animal's diet and nutrition is necessary. Option A is a valid tool for monitoring the overall health of an animal, but it is not as directly linked to nutritional deficiencies as the condition of the coat. Option C can be a trial method, but it does not provide conclusive evidence of deficiency or an appropriate dietary assessment. Option D is incorrect because behavior is more likely to reflect stress, anxiety, or illness rather than a direct link to nutritional deficiencies, and it should not be the sole measure. Question 3. What is the primary legal responsibility of an animal care professional when encountering signs of animal cruelty? A. Report the suspected case immediately to the local authorities and ensure the animal is safely removed from the situation. B. Confront the person suspected of cruelty and attempt to resolve the situation directly with them. C. Wait until the animal's condition worsens to ensure there is enough evidence before reporting the incident. D. Keep the information confidential and only report the incident if the animal dies from its injuries. Answer A. Report the suspected case immediately to the local authorities and ensure the animal is safely removed from the situation. Explanation. Under animal welfare legislation, animal care professionals are legally obligated to report signs of animal cruelty to the relevant authorities as soon as they become aware of it. Prompt reporting ensures the animal is protected from further harm and allows authorities to intervene quickly, safely removing from the situation and ensuring it is cared for are critical steps in addressing cruelty cases. Option B is not appropriate because confronting the individual could escalate the situation, and it is not the role of the animal care professional to engage directly with potential offenders. Option C is incorrect because waiting for conditions to worsen could result in irreparable harm to the animal, and laws typically mandate reporting as soon as abuse is suspected, not after a worsening of the situation. Option D is unacceptable because it ignores the legal duty to report suspected cruelty promptly, regardless of the outcome. Question 4. Which of the following best describes the primary purpose of the 5 freedoms in animal welfare? A. To ensure animals have access to veterinary care only when necessary. B. To outline the minimum standards of care required by law for all animals. C. To provide guidelines that promote animal welfare by ensuring basic physical and psychological needs are met. D. To prevent any form of human intervention in animal care to allow for natural behaviors. Answer: C. To provide guidelines that promote animal welfare by ensuring basic physical and psychological needs are met. Explanation: the 5 freedoms established as a framework for assessing animal welfare focus on addressing the physical and psychological needs of animals. These freedoms include freedom from hunger and thirst, freedom from discomfort, freedom from pain, injury, and disease, freedom to express normal behavior, and freedom from fear, distress. The guidelines ensure animals are cared for in a holistic manner that promotes their overall well-being. These principles are used globally to guide the ethical treatment of animals. Option A is incorrect because the 5 freedoms cover much more than just access to veterinary care. Option B is partially correct, but the 5 freedoms go beyond minimum legal standards and address the broader welfare needs. Option D is incorrect as human intervention, in the form of appropriate care and management, is vital to ensure the 5 freedoms are met. Question 5. Which of the following is the most important factor when creating an appropriate housing environment for animals in a shelter? A. Ensuring animals are housed together based on their social behavior to reduce stress. B. Maximizing the use of space, regardless of the species, to accommodate as many animals as possible. C. Providing a variety of enrichment opportunities to support physical and mental well-being. D. Keeping all animals in isolation to prevent the spread of diseases between them. Answer: C. Providing a variety of enrichment opportunities to support physical and mental well-being. Explanation: enrichment is essential for the physical and mental health of animals in shelters. Providing stimulation such as toys, puzzles, and interactions with caregivers helps prevent behavioral issues like stress and anxiety, which can arise in confined environments. Enrichment strategies address the need for species-specific activities, social interaction, and environmental complexity. Option A is partially correct but does not fully address the broader needs of the animals, including mental stimulation. Option B is incorrect because prioritizing space over welfare can lead to overcrowding, increasing stress, and disease transmission. Option D is also incorrect as isolation may lead to loneliness and stress, and most animals in shelters benefit from appropriate social interaction where possible. Question 6. Which of the following best explains how zoonotic diseases are transmitted? A. Only through direct physical contact between humans and animals. B. Through environmental factors such as polluted water and food supplies. C. Through bites, scratches, and other contact with infected animals or their secretions. D. Zoonotic diseases cannot be transmitted to humans from animals. Answer: C. Through bites, scratches, and other contact with infected animals or their secretions. Explanation: zoonotic diseases are infections that can be transmitted from animals to humans. The most common forms of transmission include bites, scratches, or exposure to bodily fluids, e.g. saliva, urine, or feces from infected animals. Preventing zoonotic disease transmission is a key part of both animal welfare and human health protocols. Option A is incorrect because zoonoses can be transmitted through more than just direct contact. Option B is only partially correct since environmental factors can play a role but do not encompass all means of transmission, especially direct animal-to-human transmission. Option D is completely incorrect, as numerous zoonotic diseases such as rabies are well documented and can be transmitted from animals to humans. Question 7. When managing animal behavior, which of the following is considered the most effective approach to reduce stress in an animal during handling? A. Immediate use of chemical sedatives to calm the animal. B. Applying physical force to restrain the animal to prevent movement. C. Gradual desensitization and positive reinforcement to encourage calm behavior. D. Isolating the animal in a quiet environment to minimize stimulation. Correct answer: C. Gradual desensitization and positive reinforcement to encourage calm behavior. Explanation: the most effective approach to managing stress in animals is gradual desensitization, where the animal is exposed to stimuli that trigger anxiety in a controlled manner, allowing it to adapt over time. Positive reinforcement, such as rewarding calm behavior with treats or praise, further encourages the animal to behave appropriately, reduces stress, This method is widely regarded as both ethical and effective in long-term behavior management. Option A is incorrect because sedatives should only be used when absolutely necessary, as they may have side effects and do not address the underlying cause of stress. Option B is inappropriate because physical force can exacerbate anxiety and create negative associations with handling. Option D may be useful in certain situations, but it does not address the need for proactive behavioral management. Question 8. Which of the following should an animal care professional do to recognize and address behavioral problems in animals? A. Wait until the animal exhibits severe signs of aggression or distress before taking action. B. Observe and document early signs of behavioral issues and then consult with a veterinary behaviorist or trainer for a solution. C. Immediately use punitive methods such as shock collars or harsh physical corrections to stop the undesirable behavior. D. Ignore minor behavioral issues as they will resolve on their own without intervention. Answer B. Observe and document early signs of behavioral issues and then consult with a veterinary behaviorist or trainer for a solution. Explanation. Early intervention is key to managing behavioral problems. By observing and documenting signs of stress, anxiety, or aggression, an animal care professional can assess the root causes of the behavior and consult with experts like veterinary behaviorists or trainers to develop a proper intervention. This approach ensures that the animal receives the appropriate care to address behavioral concerns without resorting to harmful or ineffective methods. Option A is incorrect because waiting until the animal shows severe signs of aggression or distress may lead to more serious behavioral or health issues. Option C is inappropriate as punitive methods, such as shock collars, can create fear and worsen the behavior. Option D is also incorrect because ignoring the problem can lead to the escalation of the behavioral issues over time. Question 9. Which of the following best describes the role of animal care professionals in ensuring compliance with animal welfare legislation? A. They are primarily responsible for enforcing the law and issuing penalties for non-compliance. B. They must monitor and report suspected violations of animal welfare laws and follow established reporting procedures. C. They only need to ensure animals are fed and housed according to basic standards. Legal concerns are the responsibility of law enforcement. D. They should focus on providing emotional support to animals without worrying about legal compliance. Answer. B. They must monitor and report suspected violations of animal welfare laws and follow established reporting procedures. Explanation. Animal care professionals are legally obligated to monitor the welfare of animals in their care and report any suspected violations of animal welfare laws to the relevant authorities. They are responsible for ensuring that animals are treated according to the standards outlined in animal welfare legislation, but do not have the authority to enforce laws or issue penalties, which is the role of law enforcement. Reporting suspected violations is a critical aspect of ensuring animals are not subjected to cruelty or neglect. Option A is incorrect because enforcing laws is the responsibility of law enforcement, not animal care professionals. Option C is incomplete as it neglects the broader legal obligations animal care professionals have, especially regarding reporting violations. Option D is incorrect because emotional support is only one aspect of their role and legal compliance is a core part of their duties. Question 10. What is the primary focus of sustainability practices in animal care? A. Reducing the number of animals in care to minimize resource consumption. B. Ensuring that animal care practices support long-term environmental, social, and ethical responsibilities. C. Maximizing profit through the sale of animal-related products and services. D. Focusing only on the physical needs of animals while ignoring environmental concerns. Answer. B. Ensuring that animal care practices support long-term environmental, social, and ethical responsibilities. Explanation. Sustainability in animal care encompasses practices that minimize negative impacts on the environment while ensuring ethical treatment of animals and supporting the welfare of the community. This includes reducing waste, using eco-friendly products, sourcing animal-related materials ethically, and promoting conservation efforts. Sustainability practices ensure the long-term viability of animal care systems without compromising the well-being of animals or future generations. Option A is incorrect because reducing the number of animals does not necessarily address the broader sustainability concerns in animal care. Option C is misguided as sustainability is not driven by profit but by ethical and environmental considerations. Option D is incorrect because neglecting environmental concerns in favor of just physical needs can lead to unsustainable practices and harm the ecosystem. Question 11. Which of the following is the best method for ensuring that shelter animals receive proper nutrition and diet? A. Providing the same type of food to all animals regardless of species, breed, or age. B. Tailoring the diet to the specific needs of each animal, considering factors such as age, size, and medical conditions. C. Feeding animals based on personal preferences without consulting nutritional guidelines. D. Only providing food once a day to encourage animals to eat quickly and reduce waste. Answer: B. Tailoring the diet to the specific needs of each animal, considering factors such as age, size, and medical conditions. Explanation: each animal in a shelter has unique nutritional needs based on factors like age, size, breed, and health status. Providing tailored diets ensures that animals receive the appropriate nutrients to maintain their health and well-being. For example, puppies, adult dogs, and senior dogs all have different diet requirements. Option A is incorrect because a one-size-fits-all approach does not address the specific nutritional needs of different species or individual animals. Option C is not ideal as animal diets should be based on established nutritional guidelines rather than personal preferences. Option D is incorrect because restricting feeding to once a day could result in undernutrition or digestive issues, particularly for younger animals. Question 12. Which of the following is a key consideration when evaluating the mental well-being of animals in care? A. Observing whether animals exhibit signs of aggression or fear. B. Determining if animals are performing natural behaviors such as playing, foraging, or socializing. C. Ensuring animals have access to large enclosures regardless of their species. D. Observing if animals are consuming their food quickly, indicating a healthy appetite. Answer: B. Determining if animals are performing natural behaviors such as playing, foraging, or socializing. Explanation: the mental well-being of animals is largely influenced by their ability to perform natural behaviors, which are essential for their psychological health. These behaviors include social interactions with other animals, engaging with environmental enrichment, and activities like play or foraging. The lack of these behaviors can be an indicator of stress or discomfort. Option A focuses on aggression and fear, which are signs of stress, but does not encompass the broader picture of mental well-being. Option C is important for physical well-being, but large enclosures alone are not enough to ensure psychological health. Option D only addresses physical health and does not reflect the full mental well-being of animals. Question 13. What is the primary objective of animal behavioral training in shelters? A. To prevent all forms of natural animal behavior to avoid issues. B. To teach animals to perform tricks for human entertainment. C. To help animals learn appropriate behaviors and reduce stress during their time in care. D. To make animals more compliant and submissive to human commands. Answer: C. To help animals learn appropriate behaviors and reduce stress during their time in care. Explanation: behavioral training in shelters is aimed at helping animals learn socially appropriate behaviors and reduce anxiety, which can make them more adaptable. Training often involves reinforcing positive behaviors and addressing undesirable ones with a focus on helping the animal feel more comfortable and confident in its environment. Option A is incorrect because natural behavior should be encouraged, not suppressed, unless it's problematic. Option B is not the primary goal of shelter training, as entertainment is secondary to behavior modification for the animal's welfare. Option D is too narrow and does not reflect the broader objective of reducing stress and encouraging healthy interactions between animals and humans. Question 14. Which of the following is the most effective way to manage disease prevention in an animal shelter? A. Relying solely on vaccines to prevent all diseases. B. Implementing strict quarantine and sanitation protocols alongside vaccinations and regular health checks. C. Only vaccinating animals that show symptoms of illness. D. Allowing animals to interact freely without any restrictions to reduce stress. Answer: B. Implementing strict quarantine and sanitation protocols alongside vaccinations and regular health checks. Explanation: effective disease management requires a comprehensive approach that includes vaccinations, quarantine for new or sick animals, regular health checks, and maintaining high sanitation standards. This helps prevent the spread of contagious diseases and ensures that animals in the shelter stay healthy. Quarantine allows for animals that might carry diseases, preventing outbreaks within the shelter. Option A is incorrect because vaccines alone cannot prevent all diseases, particularly if animals are exposed to infectious agents. Option C is dangerous because waiting until symptoms appear can allow diseases to spread within the shelter. Option D is not advisable because unrestricted animal interaction can increase the risk of disease transmission, particularly in a confined environment. Question 15. Which of the following is a primary goal when using positive reinforcement training techniques with animals in shelters? A. To punish undesirable behaviors in a way that discourages them. B. To reward desirable behaviors in a consistent and predictable manner, reinforcing positive actions. C. To use treats or toys to distract animals from undesirable behaviors temporarily. D. To ensure that animals only perform specific behaviors when instructed to do so by humans. Answer B. To reward desirable behaviors in a consistent and predictable manner, reinforcing positive actions. Explanation. Positive reinforcement is a technique that encourages desirable behaviors by providing rewards, such as treats or praise, immediately after the desired behavior occurs. This creates a positive association with the behavior, increasing the likelihood that it will be repeated. The goal is to reinforce good behavior while trust and reducing stress in animals. Option A is incorrect because punishment can lead to fear or anxiety in animals, which is counterproductive. Option C is not ideal because it does not address the root cause of undesirable behavior and can lead to confusion. Option D focuses too narrowly on obedience rather than encouraging a wide range of positive behaviors. Question 16. Which of the following is a sign that an animal in a shelter may be experiencing stress or anxiety? A. Actively engaging in play with other animals. B. Eating regularly and maintaining a healthy weight. C. Excessive grooming or self-soothing behaviors. D. Approaching humans calmly for petting and attention. Answer C. Excessive grooming or self-soothing behaviors. Explanation. Excessive grooming, licking, or other self-soothing behaviors can be signs of stress or anxiety in animals. These behaviors are often used by animals to calm themselves when they are feeling overwhelmed or uncomfortable. Other signs of stress may include pacing, excessive barking, or hiding. Option A indicates healthy social behavior, not stress. Option B suggests that the animal is physically healthy but does not address potential psychological stress. Option D represents calm behavior, which typically indicates that the animal is not stressed. Question 17. When is it appropriate to administer medication to an animal in a shelter? A. Whenever the animal shows signs of discomfort or pain. B. Only when prescribed by a licensed veterinarian based on an accurate diagnosis. C. As a preventive measure for all animals, regardless of their condition. D. When the shelter staff feels it is necessary to calm the animal. Answer B. Only when prescribed by a licensed veterinarian based on an accurate diagnosis. Explanation. Medication should only be administered to animals when prescribed by a veterinarian who has made an accurate diagnosis. Improper use of medication can lead to harmful side effects or mask underlying conditions that need proper treatment. Self-prescribing or using medication without professional guidance can be dangerous. Option A is not recommended because pain or discomfort should be properly diagnosed by a veterinarian before medication is given. Option C is incorrect because giving medication to healthy animals is unnecessary and could be harmful. Option D is incorrect as medication should not be used merely to calm animals. It should be for treating medical conditions as prescribed by a veterinarian. Question 18. What is the primary goal of environmental enrichment for animals in shelters? A. To keep animals occupied with distractions to prevent them from becoming bored. B. To reduce stress, encourage natural behaviors, and improve the overall well-being of animals. C. To limit the amount of space each animal has to make cleaning easier. D. To make the shelter environment look more appealing to potential adopters. Answer B. To reduce stress, encourage natural behaviors, and improve the overall well-being of animals. Explanation. Environmental enrichment is designed to enhance the mental and physical well-being of animals in shelters. It encourages natural behaviors such as foraging, climbing, and social interaction, reducing stress and anxiety. Enrichment can involve toys, puzzle feeders, varied routines, and other stimuli that engage animals and make the environment more fulfilling. Option A focuses only on distraction, which is not the primary goal of enrichment. Option C is counterproductive as reducing space and limiting animal movement can increase stress. Option D is not the primary goal of enrichment, which is centered on the animal's well-being, not aesthetics for adopters. Question 19. Which of the following is an effective strategy to prevent the spread of contagious diseases in an animal shelter? A. Allowing animals to interact freely to maintain socialization. B. Quarantining new animals and those showing signs of illness until they are cleared by a veterinarian. C. Cleaning the shelter only when an outbreak occurs. D. Limiting the number of animals to the absolute minimum to reduce risk. Answer: B. Quarantining new animals and those showing signs of illness until they are cleared by a veterinarian. Explanation: Quarantining new animals and those showing symptoms of illness helps to prevent the spread of contagious diseases within the shelter. This practice allows for monitoring the animal's health status and reduces the risk of infecting other animals. It is essential to ensure that the quarantine area is separate from the general shelter population, properly sanitized. Option A is not advisable as unrestricted interaction can increase the risk of disease transmission. Option C is incorrect because regular cleaning and sanitation should be part of ongoing procedures, not just in response to outbreaks. Option D may not always be feasible or necessary and does not address proper disease management strategies like quarantine and sanitation. Question 20. What is one of the most important factors in the adoption process for animals in a shelter? A. The size and breed of the animal. B. The potential adopter's lifestyle, experience, and ability to meet the animal's needs. C. The age of the animal, with preference given to younger animals. D. The appearance of the animal, including coat color and markings. Answer: B. The potential adopter's lifestyle, experience, and ability to meet the animal's needs. Explanation: The most important factor in the adoption process is ensuring that the adopter's lifestyle, experience, and ability to meet the animal's needs align. This includes considering the adopter's ability to provide the right environment, time, and care for the animal. Matching the right animal with the right home is crucial for the animal's long-term well-being. Option A is not as important as the adopter's ability to meet the animal's needs. Option C focuses on age but does not take into account other essential factors such as behavior or compatibility with the adopter. Option D is not a reliable factor for adoption as it focuses on physical appearance, which is less important than ensuring the adopter can care for the animal. Question 21. What is the primary benefit of providing proper animal socialization in a shelter environment? A. Ensures that animals become more appealing to potential adopters. B. It reduces the likelihood of behavioral problems by promoting positive interactions with people and other animals. C. It makes it easier for shelter staff to manage the animals. D. It allows animals to bond with each other, creating a stronger sense of community within the shelter. Answer: B. It reduces the likelihood of behavioral problems by promoting positive interactions with people and other animals. Explanation: Proper socialization in a shelter environment helps reduce the likelihood of behavioral problems such as fear, aggression, or anxiety. Socialized animals are more comfortable with people and other animals, making them easier to manage and more likely to transition smoothly to their new homes. Socialization in positive, controlled exposure to various stimuli and experiences. Option A is a secondary benefit, not the primary one. Option C is a result of proper socialization, but the main goal is to ensure positive behavior. Option D is not the primary purpose. While bonding can occur, the focus is on socialization with humans and other animals for behavioral development. Question 22. What action should be taken if an animal in a shelter shows signs of severe aggression? A. Immediately remove the animal from the shelter and release it into the wild. B. Isolate the animal from other animals and staff while seeking professional behavior assessment. C. Encourage staff to handle the animal regularly to desensitize it to human presence. D. Allow the animal to interact with the other animals in a supervised setting to calm it down. Answer: B. Isolate the animal from other animals and staff while seeking professional behavior assessment. Explanation: If an animal in a shelter shows severe aggression, the first step is to isolate it from other animals and staff for safety reasons. Aggressive behavior should be assessed by a professional to determine its cause and the most effective management strategies. Isolation prevents potential injuries and allows the animal to be observed and evaluated in a controlled environment. Option A is inappropriate as releasing the animal into the wild is dangerous and unethical. Option C could escalate aggression if the animal is not ready for handling. Option D is not advisable because allowing interaction during aggressive episodes could increase the risk of harm to others. Question 23. Which of the following best describes the role of enrichment in animal behavior management in shelters? A. Enrichment should only be used for highly energetic animals. B. It is meant to occupy animals during their stay in the shelter without focusing on their emotional well-being. C. Enrichment provides mental stimulation, reduces stress, and promotes natural behaviors, improving the animal's quality of life. D. Enrichment is only necessary for animals with behavioral issues. Answer: C. Enrichment provides mental stimulation, reduces stress, and promotes natural behaviors, improving the animal's quality of life. Explanation: Enrichment is designed to provide mental stimulation and encourage natural behaviors that are crucial for the animal's emotional and psychological well-being. It helps reduce stress, boredom, and anxiety, which can lead to better outcomes for adoption. Enrichment activities can include toys, interaction with other animals, and environmental changes that mimic natural habitats. Option A is incorrect, as enrichment is beneficial for all animals, not just energetic ones. Option B overlooks the emotional and mental benefits of enrichment. Option D is not true, because all animals, regardless of behavior, benefit from enrichment to maintain well-being and prevent behavioral issues. Question 24. Which of the following is a key consideration when designing an animal housing environment in a shelter? A. Ensuring the housing is large enough for the animal to move freely but not necessarily suited to their specific needs. B. Providing a uniform environment for all animals, regardless of species or individual needs. C. Accommodating the specific species and individual animals' physical, behavioral, and psychological needs to improve welfare. D. Focusing solely on the aesthetics of the housing to appeal to potential adopters. Answer: C. Accommodating the specific species and individual animals' physical, behavioral, and psychological needs to improve welfare. Explanation: Designing animal housing in shelter requires considering the specific needs of each species and individual animal, including factors like space, temperature, ventilation, and enrichment opportunities. The aim is to provide an environment that supports the animal's physical health and psychological well, fostering sense of security and comfort. Option A is partially correct, but overlooks the specific needs of the animal. Option B fails to recognize that different species have different requirements. Option D is not the main priority. The animal's welfare should be the primary focus, not aesthetics. Question 25. Which of the following is an important step to prevent the spread of zoonotic diseases in animal shelters? A. Minimizing direct contact between animals and the general public to prevent transmission. B. Administering regular vaccinations to both animals and shelter staff. C. Avoiding all interaction between shelter staff and animals to reduce the risk of transmission. D. Keeping animals in isolation at all times to prevent exposure to other species. Answer: B. Administering regular vaccinations to both animals and shelter staff. Explanation: Regular vaccinations for both animals and shelter staff are crucial in preventing the spread of zoonotic diseases, which are diseases that can be transmitted between animals and humans. Vaccinating animals helps protect them from common diseases, while vaccinating staff reduces the risk of disease transmission to humans. Option A is only partially effective, as it focuses on limiting public interaction but does not address the broader issue of disease prevention. Option C is impractical and unnecessary, as appropriate handling and safety measures allow for interaction while minimizing the risk of transmission. Option D is also excessive, as animals do not need to be isolated unless they are sick or show signs of disease. Question 26. Which of the following is the most effective method for managing a shelter population of both dogs and cats with varying temperaments? A. Keep all animals in the same open space to encourage socialization and bonding. B. Separate animals based on temperament and species to prevent stress and reduce the risk of injury. C. Allow free interaction between dogs and cats to promote socialization, regardless of behavior. D. Provide no socialization at all and allow animals to remain isolated to reduce potential conflicts. Answer: B. Separate animals based on temperament and species to prevent stress and reduce the risk of injury. Explanation: Separating animals based on their temperament and species helps prevent stress, reduces the risk of injury, and allows each animal to have a safer and more comfortable environment. Dogs and cats often have different social needs, and body language and interactions between species or incompatible temperaments can lead to or anxiety. Option A could cause stress and conflict among animals with different temperaments. Option C can lead to aggression, particularly between animals with incompatible behaviors. Option D does not foster socialization and could result in a more fearful or anxious shelter population. Question 27. What is the primary goal of pre-adoption behavioral assessments for animals in shelters? A. To identify which animals are most likely to be adopted based on their appearance. B. To determine which animals are aggressive and need to be euthanized. C. To evaluate an animal's suitability for adoption, identifying any behavioral concerns that may need to be addressed. D. To ensure that all animals are kept in the shelter for as long as possible. Answer: C. To evaluate an animal's suitability for adoption, identifying any behavioral concerns that may need to be addressed. Explanation: the primary goal of pre-adoption behavioral assessments is to evaluate the animal's behavior and temperament to determine its suitability for adoption. This helps identify any behavioral concerns that may need to be addressed before adoption or informs potential adopters about the animal's needs, ensuring latch. Option A overlooks the behavioral factors that should guide adoption decisions. Option B is extreme as not all behavioral concerns lead to euthanasia. Option D contradicts the goal of finding home for animals and focuses on prolonged shelter stays. Question 28. Which of the following best describes how to handle a fearful or anxious animal in a shelter environment? A. Immediately force the animal to interact with people to help it overcome its fear. B. Use a calm and patient approach, providing a safe and quiet space while allowing gradual socialization at the animal's own pace. C. Allow the animal to remain isolated indefinitely to avoid causing further stress. D. Place the animal in a high traffic area to help it become desensitized to noise and people. Answer: B. Use a calm and patient approach, providing a safe and quiet space while allowing gradual socialization at the animal's own pace. Explanation: fearful or anxious animal needs calm and patient approach. Giving the animal safe, quiet space and allowing gradual, controlled socialization at its own pace can help build confidence and reduce fear without overwhelming the animal. Rushed interactions can increase stress and exacerbate fear. Option A could worsen anxiety and fear. Option C does not help the animal overcome its fear, as isolation may increase stress over time. Option D could increase anxiety by exposing the animal to overwhelming stimuli too quickly. Question 29. What is the role of the intake process in animal shelters? A. To assess whether the animal can be immediately adopted without further assessment. B. To ensure that animals are vaccinated and receive basic medical care while assessing their health and behavioral needs. C. To place animals in the most visually appealing housing for potential adopters to view. D. To ignore any behavioral concerns and focus solely on providing food and shelter. Answer: B. To ensure that animals are vaccinated and receive basic medical care while assessing their health and behavioral needs. Explanation: the intake process in shelters involves a comprehensive assessment of the animal's health and behavior. During this process, animals receive necessary vaccinations, basic medical care, and are evaluated for any behavioral concerns. This helps ensure that the animals are well cared for and prepared for adoption. Option A is unrealistic, as most animals require thorough assessment before adoption. Option C prioritizes aesthetics over animal welfare. Option D overlooks the importance of behavioral evaluation and health care, which are critical for the animal's well-being. Question 30. Why is it important for shelter staff to receive training on animal behavior and handling techniques? A. To ensure that staff can manage animal populations without needing any outside assistance. B. To prevent injuries to both animals and staff and to understand how to address behavioral issues effectively. C. To improve the visual appeal of animals, making them more likely to be adopted. D. To reduce the time spent on animal care by avoiding unnecessary interactions. Answer: B. To prevent injuries to both animals and staff and to understand how to address behavioral issues effectively. Explanation: proper training in animal behavior and handling techniques is essential for ensuring the safety of both shelter staff and animals. Trained staff can assess behavior, use safe handling methods, and address behavioral issues in a way that minimizes stress and injury. Effective handling techniques also promote positive outcomes. Adoption: Option A is not accurate, as outside assistance like veterinarians or behaviorists may still be needed. Option C overlooks the importance of safety and welfare in favor of appearance. Option D neglects the importance of providing care and understanding animal needs.